Before we get into, shoulder issues, we got to understand the scapula. This is going to be the biggest issue that really no one looks at when looking at shoulder pain. You have, the shoulder blade, the scapula, the flat part, and then you have these two pieces that protrude forward over your shoulder and under your shoulder, your humerus, called your acromion and your coracoid process. And we'll get into that in a little bit. But what I want you to look at is the movements of the scapula. To break it down real easy, the scapula can move upwards, downwards, lateral, and medial. It can even tilt both ways, and it can also rotate clockwise and counterclockwise. So we need to know that before addressing any issues with the scapula. So you made it this far. We're looking at the back of the left scapula. This is your whole scapula. Like I said, we had these two parts that come through to the humerus. It's going to be this area called your acromion process. This is the AC joint when we have a shoulder dislocation or AC joint separation. This is the part that they're talking about. And then we have the coracoid process right here. And we can see that acromion, it comes all the way over top of this humerus, and this scapula is in a good position. But if we do, move this scapula clockwise up this way, it's not just going to move this bottom part. It's going to move this top part along with it. That might pinch and impinge some of these areas. A lot of people are dealing with, bicep tendonitis or any other type of issue. And, most of our pain is going to be right in this area. When we add some muscle onto this model, we can see, oh, look at that. We've got that teres group right there, teres minor. We have this coracobrachialis right underneath the bicep. And if you have a tight teres minor, it's probably going to limit some scapular movement. And if we add another layer of muscles, you can see teres major, rhomboids go in there as well. And then the deltoids come over top, and we twist a little bit. We can see, hey, we've got this supraspinatus underneath. We've got this bicep tendon right there. And then we have the short head of the bicep right there. And it's going to cause some friction, some pain. If this acromion kind of comes over top, itching away at this muscle, or even the coracoid underneath, putting some pressure on some of these other muscles. So that's what we're looking at. I'm not trying to diagnose anybody. I'm not trying to help you diagnose yourself. I'm just giving you a quick anatomy lesson of the scapula and the surrounding muscles, so we know how important the scapula is and what we can do to help get it better. So first, we're going to start with four-way shoulders. This is a really great movement. We're going to start with flexion extension, and we're going to do across the body, adduction and abduction, and then we're going to do rotation of the proximal humerus. These are great moves to know where your shoulder's at, and I also like to do them because we can do them from very mildly intense to even more intense. We can increase range of motion or decrease range of motion. These moves, they're great. These are shoulder rolls. We're going to take that band, wrap it around our shoulder. We're going to go forward, backwards rolls. I like doing the punches as well. And then we're going to reverse those movements and basically do the exact same thing. We're going to do backwards rolls, forward rolls. And these are really good because nothing's going to get your shoulder capsule moving like these and like the four-way shoulders. They're great. I don't even stretch after I do these. And this is the lawnmower pull stretch. Great, great move. Arm circles, self-explanatory. forwards and backwards. You can do large circles, you can do small circles. Now I call this in the office shoulder retraction. We're not rounding the shoulders back. We're gonna go up, back, and down. This helps kind of reset the scapula and stretches out those pecs, tightens up the rhomboids in the back to help stabilize that position. And this is a great position. You can do this multiple times a day. Now this is gonna be assisted shoulder extension. We're going to grab either supinated or pronated. Supinated is when the thumbs are out. Pronated is when the thumbs are facing in. And we're going to, increase this angle by doing some type of squat, bending down. You can start with the bar much lower or higher. And then again, we're going to do the pronated grip as well. This will put a lot less tension on that front area of the shoulder if the supinated grip is a little bit too much. But we're just looking to increase our range of motion in that position. Next, we're doing vertical foam rolls. You can use this to stretch out and work horizontally the paraspinals and the rhomboid muscles. But for this move right here, it's more of a proprioceptive move and a joint position move where you are moving your arms through adduction and abduction, finding any sticky areas, finding any place where you're limited or where there's pain. And if there is, you're going to hold that position until the arm lets go. And like I said, hey, we're going to do this vertical foam rolling. I like to think of it as a bear itching its back on a tree. Here we're doing scapular push-ups. They do feel weird if you've never done them before. We're really just doing the top end of the push-up plus a little bit more. You do not want the elbows to bend. This is not a tricep or chest move. This is a scapular move. So just make sure that those elbows do not bend and we go up and down. It is a very little movement, but you might have extreme little movement while doing this. But the more you do it, you will increase that range of motion. You'll get that scapula to move the way it should move. Here we go, scapular pull-ups. You will feel a deep stretch in your lats, in your pecs, your teres group. If you're doing these correctly, you want to come all the way down. And again, we're not bending the elbows. This is just a scapular move. They're going to feel great. It's a different stimulus. It's going to feel a little weird when you first start doing it. And again, it's not a big movement. These are scapular rows. You want to feel that deep stretch behind the back where the scapula is. And, again, we're not bending the elbow. This is specifically a scapular move. And you can also use this as a stretch. A lot of the training I do, I like to feel that deep, deep stretch at the end of a move so I can, number one, build a little bit more range of motion, but also I feel like it without being scientific, we're just recruiting more muscle fibers to do joint work out of that stretch position. A lot of my moves are like this. A lot of exercise I do. You can stimulate this same feeling in different parts of the body. This is thoracic extension. We're going to have a few different thoracic extension moves in here. With that bar, you can move it up or down. You will feel a stretch in your pec, but more so what we're trying to do is unround our back and put it to an extension. Like I said, we're going to have a few moves like this that are very, very similar. It's really all about where your center of gravity is and which one is going to be easier for you to accomplish before you move on to the next one. I've also seen people wrap a band around their mid back to increase extension, or even put a weight belt with some weight there, and they kind of do thoracic extension and then thoracic rounding to kind of gain some muscle in there. These first few rows are normal rows. After the first three, I'm going to reset right now, and we're doing rows where we're really trying to get the bottom part of the scapula to kiss instead of the whole scapula. I know you've heard, hey, act like you're pinching a piece of paper between your shoulder blades. Well, in this move, we're not pinching it between our whole shoulder blades. We're really trying to put emphasis on that bottom inferior medial part of the scapula. They feel very weird. It's not much movement. Like I said, it's not so much about bending the elbows, even though they will bend a little bit. It's more so feeling that tension in the mid back. This is the thread the needle stretch. You can do this without the band. You can do this with a rope or with the band. It's always nice to just kind of start without the band so you can see where your back is and see what kind of rotation you have in your thoracic spine. Again, this is going to be, it's going to help with thoracic movement and scapular movement. It's going to be a really nice deep stretch through your mid back. These are pendulum exercises. When we're doing these, we're going to try to go back and forth, left to right. We're going to do circles clockwise and counterclockwise, as well as figure eights in both positions. And we can even go diagonally. It's a nice stretch. It's a nice move for the shoulder to allow something else to move you. It's kind of like assisted stretching. Try to make sure you're using something like a kettlebell or maybe even a heavy ball. It was kind of weird to try to get that dumbbell to move the way I wanted it to. This is assisted stretching. You're basically going to take a pole, broom, dowel, whatever, and use it to take your hurt arm or hurt shoulder and put it through various ranges of motion. Right here, we're working on external rotation, and we can even do abduction and adduction as well. You can use any movement, just play around with it. So we all know the crossbody stretch. That's great for the deltoids and the traps and the shoulder, but I like to do this assisted crossbody stretch where I'm using my body weight to pull me out, and then we can even do some muscle pulls in there to work the muscle out and gain some strength in that position. These are different areas along the deltoids and the rotator cuff muscles that you can put some type of sustained pressure on to work that muscle out. There's no right or wrong place. I tell my patients to search and destroy. You find an area that has a little bit of pain on it or a lot of pain, and you do sustained pressure on that until the pain starts to subside. It will subside usually after about 10 to 30 seconds. If you have big muscles or you're well conditioned, it might take a little longer than that. I've had a professional athlete that I had to hold this for 5 minutes multiple times. So you just got to work with your body and listen to it. Everyone knows the door stretch. It does work for pecs, but it will put some tension in through your biceps. A lot of times when the shoulder is hurt, we have some type of bicep issue that feels like a shoulder issue, but it is some type of impingement of the bicep. This is a nice stretch. You can hold it for as long as possible. Some of these stretches, a lot of these stretches, since this is a therapy, we want to hold them, not just for 15, 20 seconds. We want to hold some of these stretches, upwards of 1 to 3 minutes. These aren't warm-up stretches for exercise. This is a therapy to create change in the muscle. I think we've all kind of done the pec stretch against the wall or in the door. I like doing them like this better. You can do them two-handed or single-handed, but what I really like is how I push forward a little bit and get a lot more pull on my pec. You can even, alter the way you're hanging so it can put a little bit more tension and pressure on different areas of the pec and different areas of your shoulder. On Amazon, you can get these tools. It's called a J hook, and basically we're going to use it to do some trigger points just to save your thumb. I can do all these moves with my thumb or with a lacrosse ball or something else, but we're just finding these areas like with the shoulder and putting pressure into them until that pain kind of goes away. And, we can hit the front, but on this move, we're hitting the inside of the pec and the underneath of the pec. They're just hitting everything that we can, putting some type of stimulus in the muscle so we can create change. Deficit push-ups or just sitting in that deficit position is great. Obviously, start out low. I can definitely go higher than, this, about 1.5 inches. But you just want to, just like any type of exercise, progressive overload, start out minimally and work yourself up to what you can manage, and try to increase that height every time you do this. Even if it's by, the width of a towel, a centimeter or anything, it's going to go a long way. Again, we're using the J hook. Great tool to have if you don't have it. I love the shape of this one, not the candy cane style, but we're doing pinning stretches on our trap and tilting our head away from that muscle so we can increase the length and get maximum stretch. And I'm going all along my upper, middle, and low trap, and just moving my head in various positions to get the desired outcome, the stretch that we want. This is another way to stretch the trap out. You're gonna pull your right arm down and tilt your head to the left. And if you want to do the left side, you're gonna pull the left arm down, tilt the head to the right. You can even bend your head forward and rotate as well. These are I's, Y's, T's, and L's. We can do them, elevated or supine, flat on the bench. The I, you want to make sure that thumb is up, and on the Y's and T's, you can have palm down. Even if you have, 2.5 pounds, 5.5 pounds, this will help strengthen those areas. And a little bit of weight goes a long way. You can even do sustained isometric holds with these. I usually go to about 5 or 15 seconds per hold. If you do 4 of these moves, 15 seconds, that's a minute isometric holds in each, in that position. And you can do 3 sets of that. And again, start at 5 seconds, work your way up. So these are chest assisted rows. They're going to hit the lower trap. Most people have tighter upper traps and weaker lower traps. So we're just trying to round out that muscle development. I actually have a patient right now who has some type of scapular dyskinesis. His trap does not let go. When we can get his trap to let go, his shoulders move amazing. But when that trap stays tight, he gets anterior and superior shoulder pain when he lifts his hand over his head. So this is a great move, like I said, to develop that lower and middle trap area. We've all done this type of stretch. If you kind of tilt towards the arm you're holding on, sometimes we'll get some pressure and a stretch under that scapula and under that teres group. This is a really nice way to stretch not just the lats, but the rhomboids and some of the other back muscles that are surrounding the scapula. Another move we've done before, tricep stretch. This way I like to put it against the wall. It doesn't hit the tricep as much. It really gets that upper lat, teres group, part of your rotator cuff that attaches to the scapula. If it's tight, it's going to limit movement of the scapula. And like I said, you can add that little bit of rotation in to really pinpoint that underarm area. So this is a rotator cuff stretch. Basically what we want to do is eventually get that palm touching the ground or as close as we can. You do want to make sure that half of your back is on the ground so we can stabilize that scapula. It's going to be a really easy move if your scapula is not stabilized. If you have very limited movement in that position, you might want to change positions, either on your side or hanging off an edge so you can increase that angle a little bit more. And sometimes it's not just a 10 or 15 set thing. Sometimes I do have patients hold these stretches for 30 seconds to a minute and a half or even longer so we can gradually get that arm all the way down, because like I said, 2 sets of 10 might not cut that. Another great scapula strengthening and stretching move. When it comes back, the weight comes back, your shoulder, front of your shoulder, your chest is going to get a nice stretch, very similar to a throwing motion. And you can use a heavier weight to strengthen those muscles as well. And you can also just change the way you're laying to target some other muscles, make it a little harder or make it a little easier for you. This is a very similar move. We're using the band. You do not want to have the elbow bent like that. If we're doing a tricep move, we're really trying to get that shoulder into external rotation. And then again, you can do work out of that position to help strengthen your body in that provocative position. You've probably seen these on Instagram. What are they for? They're for a muscle called your serratus anterior. I like to do a full body movement, get a little bit of extension in there as well, because it's going to prep us for the next move, which is a pullover. So when we're doing these pullovers, I do not care how much you can do. This is going to be more of a allow our body to stretch in that bottom position, create, thoracic extension, change the angle of that scapula, the way it moves. And again, we're getting into a deep stretch and building motor units out of that position just to help strengthen that area. One of my patients can do a split really well, and he's about my size. And I, asked him, what got you, how'd you get to the split? It's really hard for me to get there. And he said, Perry, it's less of teaching your body to be flexible into a split and more so strengthening the muscles in your groin to allow your body weight to sit in that position. So that was a, real eye-opening to me, because I just thought about it being a flexibility issue, but it's also a strengthening issue because you're holding, your whole weight in between your legs by your groin, which is very, very painful. This is the bench prayer stretch. It's a, great lat stretch, great Terry's group stretch, but also it's going to get the scapula moving and tilt in a different way and also create some type of thoracic extension. A lot of people have rounded thoracic spines, and that's going to push your scapula outwards. So before the scapula can go in, we need to unround the back so they have a place to go. And very similar to the pec stretch is the hanging lat stretch. And again, we're just going to grab the bar, go forward a little bit, and then bend to the same side that we're hanging from. That is going to really put a lot of stretch all the way down that upper body area. Very similar to the lat stretch is the scaling stretch. You want to make sure that your arm is bent behind you. That's going to help depress the rib, and then you're going to tilt your head away from the arm you have bent behind your back and rotate. Scalenes are big rotators in the neck, and rotating away from the arm is going to put the maximum stretch on the scalene. This is nerve flossing. We're going to be doing medial and ulnar nerve flossing. Basically, when you're in this position, it's the shortest, and when you're in the lengthened position, it's the longest. You can check out some videos on ulnar and radial nerve flossing. It's a little bit more than I wanted to get into, but sometimes neural tension can mimic shoulder pain and shoulder issues. So we want to make sure that we don't have, tight nerves, pinched nerves, neural tension that's creating this pain that you're having, because we're going to address it a little differently. And a good way to unfree those nerves and get them moving is through these nerve glides, these cervical nerve glides. And there's a decent amount of them. This is first rib mobilization. Like I said, the scalenes are attached to the first rib. So not only are we stretching the scalenes, we're also trying to move that first rib a little bit. And we're going to lean the head, and we're also going to move the arm as well to attack it from different positions. If that rib is too tight, it can put pressure on some of the shoulder and decrease mechanics. Now, I just wanted to show you guys how good my curl form is, but for real, when the weight is going up, that's a concentric movement. As the weight is coming down, like now, that's an eccentric movement. And after this, we're going to do an isometric hold. So a lot of shoulder injuries, it's not so much the muscle, it's the tendons, it's the ligaments involved. So concentric and eccentric movement help create load on that tendon or ligament without creating too much movement that might aggravate it. It's going to increase blood flow to that area. And from what the papers say, isometric and eccentric loading is going to help repair tendon issues and help with tendon stiffness. Thank you guys for watching. If you like the video, like and subscribe. If you have any questions, drop a question in the comments. I'll be sure to answer it to the best of my ability. Talk to you guys soon.